A woman in her 50s walked into an ER in Alaska, struggling to breathe. Hours later, she was dead. Doctors were stunned. She showed no symptoms of a sexually transmitted disease. But what killed her was disseminated gonorrhea infection, which is an advanced deadly form of common sexually transmitted disease in the world. In this video, we will uncover this shocking case, how you can protect yourself, and the vaccine that could turn the tide. In June 2025, a woman in 50s died after arriving at an Alaska emergency room with respiratory distress. The doctors were shocked when they found the cause, disseminated gonorrhea infection DGI, meaning gonorrhea infection spread into her bloodstream and lungs. This gave raised alarms because she had no typical gonorrhea infection like vaginal discharge or pelvic pain. It suggests that resistant strains may be circulated in the general population. Health officials warned DGI might be more common than we think and had to detect early. Gonorrhea infection is the second most common bacterial STIs in the world after chlamydia. It's caused by bacteria Neisseria gonorrhoeae. It can infect genitals, rectum, throat, and eyes. It can spread through unprotected sex, vagina or inner sex, rarely mother to baby during childbirth. Many people, especially women, have no symptoms. But if someone has symptoms, the following are burning urination, genital discharge, lower abdominal pain in women, testicular pain in men, rectal bleeding or a sore throat in gonorrhea. Risk factor for gonorrhea infection, multiple sexual partner, unprotected sex, men who have sex with men, MSM, sexually active youth, 15 to 29 age group, and previous STIs. If untreated, gonorrhea infection can lead to pelvic inflammatory disease (PID) in women, which is the inflammation of the uterus, fallopian tubes, and ovary, and later result in infertility and chronic pain. Epididymitis, testicular swelling and pain, and prostatitis in men, which can cause infertility. And finally, disseminated gonorrhea infection DGI, meaning gonorrhea spread to joints, which can cause joint pain and swelling, called septic arthritis. And rashes or SQ are formed in our skin, septic shock, and even death, as in Alaska case. During pregnancy, gonorrhea infection can cause preterm labor and miscarriage. During childbirth, it can spread from mother to babies, causing eye infections and newborns, also called gonorrhea ophthalmia neonatal. If not treated well with antibiotics, can lead to permanent blindness. Prompt test in 2019 UK, portable test developed in London, rapid on cartridge purification and magneto testing, 15-minute turnaround, and ideal for STI clinics, but now less commonly used, replaced by an AAT, nucleic acid amplification test. So today's standard diagnostic test for the gonorrhea infection is an AAT, urine swabs from genital, rectum, or throat. Higher sensitivity and widely used in sexual health clinics. For uncomplicated gonorrhea, ceftriaxone 500 mg intramuscularly, single dose. Add doxycycline 100 mg twice daily for 7 days if chlamydia not ruled out. But for DGI, ceftriaxone 1 gram intravascularly until 48 hours after symptoms improvement. Then switch to oral ceftriaxone 400 mg twice daily to complete 7-day total course. Gonorrhea mutates fast and can exchange genes with other bacteria. Global travel and antibiotic misuse make it worse. Overuse of antibiotics, especially self-indication, result in antibiotic resistance. Ciprofloxacin and azithromycin are no longer reliable in many regions. Ceftriaxone is the last major defense, but many resistant strains are emerging, forcing many vaccines like Saro. This vaccine is designed for meningitis B, but offers 30 to 50% protection against gonorrhea. It works by cross-reacting with similar bacterial structure. The UK to pilot gonorrhea vaccine program in August 2025 for high-risk group, especially MSM. Doxycycline-PEP post-exposure prophylaxis, 200 mg of doxycycline within 72 hours after unprotected sex. Data shown to reduce chlamydia, syphilis, and gonorrhea, bad under review. So take advice from your medical professionals. Doxycycline-PEP is not for everyone, but for MSM and other high-risk groups. Prevention: do's and don'ts. Use condoms for any sexual activities, vaginal, oral, or anal sex. Regular STI screening with new sexual partners. Communicate openly with your sexual partners. Complete all antibiotics as prescribed. Don't rely on symptoms, and when you don't have any, don't resume sex until your sexual partners has completed antibiotic treatment course and follow-up tests show you are no longer infected. If you have any symptoms I told above, you should go and see medical professionals. But even if you don't have and you think you might have gonorrhea, you should go to STI clinics. And if you are pregnant or planning to get pregnant, go and see medical doctors. Take home message: gonorrhea isn't just a mild STI, it's evolving into global superbug. The death in Alaska is a wake-up call. We need more awareness, earlier testing, and smart prevention. The best defense: regular testing, safe sex, early treatment, and education. Like this video if you learn something new. Share to help spread awareness, because many don't even know what DGI is. And subscribe for weekly health breakdowns, vaccines, outbreaks, and how to prevent yourself in a changing world.